Time now, 7:21. Depression and post-traumatic stress among healthcare workers could become the new norm unless action is taken. That is the warning from medical charity Doctors in Distress.
Now they're saying more needs to be done to support doctors' mental well-being during the second wave of the pandemic. And we can speak now to the chair of the organisation, Dr. Claire Gerada. Morning to you. How are you today?
Good morning, Rachel. Well, as well as everybody else's, I suspect.
Well, when you read actually some of the details of this report, it really is quite upsetting to see the sort of stress levels that medical practitioners are under at the moment. Just give us some of the headlines.
Yes, of course. Well, I run a service for doctors with mental illness, as well as being chair of the charity Doctors in Distress. Pre-pandemic, we were seeing about 60 new referrals a week. Last week, we had 120. So these are doctors with mental illness, doctors with depression, anxiety, post-traumatic stress disorder happening now. So the numbers, just like the numbers of cases of COVID, the numbers that we're getting to our service are increasing almost in a straight line upwards. And I think, and also within those numbers, we're seeing more younger people. So the average age is between about 30 and 35. And also more doctors who are trained overseas. We call them international medical graduates because they are more likely to be BAME doctors, black and minority ethnic group doctors, and they're more likely to have roles and jobs that are insecure, maybe working at a peripatetic way or locum way. So we're seeing a lot of distress from the medical profession. We're not looking at the other groups, but I suspect you'll find it replicated amongst nurses as well.
Yeah. So you're seeing it across the board, but in particular amongst certain vulnerable groups. Does that mean then you need to get out and really target the support that's being offered?
Yes, we do. But it's like squeezing a balloon. Once you target one group, then another group pops up. So during the first wave, for example, we did offer services to doctors, for clinical leaders, to doctors from overseas and to younger doctors. But now, as I said, we're seeing slightly the 30 to 35-year-old group. So we do have to target support, but we also have to make sure that right across the board there is a moral imperative now as we enter this second stage that we provide support, services, easily accessible mental health service for all staff across the NHS and social care, because if we don't have the staff, because if they're going off sick with mental illness, then they won't be there to look after me, you, our relatives when we fall sick.
And it's just not just the psychological stress, but actually also the physical stress of certain conditions you're working in, 12-hour shifts, wearing full PPE.
Absolutely. But in fact, this isn't just hospital doctors. And I think we've been focusing, especially in the first wave, on hospital doctors and those working in intensive care. And of course, they're struggling because of the PPE and the intensity of their work. But it's also doctors such as myself, GPs. We're working in our own homes. We're working sometimes in our bedrooms. There's no support. We're dealing with really quite distressed patients. And we're still having the intense relationships with our patients that may well impact on our own mental health, because bear in mind, we're all in this together, really. Doctors are not immune from the virus, and we know that many doctors have died from the virus, and we're also not immune from the other emotions that we're all experiencing, as your previous item showed, unemployment, insecurity, and everything. So there is an imperative now. I think what we need to be doing is making sure that we look at the work that the doctors are doing, look at the intensity, look at these long shifts. 12 hours is far too long. Make sure there are breaks put in. Make sure there are spaces that doctors and nurses can come together. I know we're in a pandemic. It's difficult physically, but we can do that in different ways to come together to actually talk about the emotional impact of their work.
Yeah.
And then provide services to pick up those that are mentally ill.
Well, you know better than anyone what it's like. You've been there in the thick of it. Last time we spoke to you, actually, was as you were recovering from COVID-19. But it's good to see you looking better now. Do you feel like you have completely recovered?
Yes, but in retrospect, Rachel, I think it took about 4 months. As many doctors, and I'm the worst of them, I wanted to rush back to work, and I did rush back because I wanted to get my hands in and start helping. In retrospect, I think it took 4 months till I was completely better, till I stopped getting those terrible muscle aches which I had, and also the fatigue. And I know many people are describing similar symptoms. All I can say is it does get better. And the other day I managed to do an 8K run for the first time in in months and months and months. And though I was tired after it, I wasn't tired in the way that COVID made me tired. So there is light at the end of the tunnel for those who do get COVID. I was one of the first to get it in this country, so maybe I can give you some hope that we will get through this, and people who've had the virus will get through it.
Yeah, you certainly do. You're putting us all to shame this morning with your 8K run. Thank you very much. Nice to talk to you, Claire Gerada.
It's good to hear that, isn't it?
Yeah.
It is good to hear
Impressive.
that. Reassuring for a lot of people. 7:27.